A judge has ruled there will not be another trial in the case of Blue Cross Blue Shield covering breast reconstructive surgeries. Earlier this year, a jury awarded over $400 million to a local surgical hospital, finding the insurance company defrauded the hospital after refusing to pay for surgeries that Blue Cross Blue Shield initially authorized. Alyssa Curtis has more on the judge's newest ruling.
When someone gets diagnosed with breast cancer, sometimes they have a mastectomy. Then in some cases, patients have reconstructive surgery. But according to Kim Sport with the Cancer Association of Louisiana, there are hurdles to get that needed care.
It wasn't until after I was able to complete my reconstructive surgeries that I realized that 8 out of 10 women were not being told that reconstructive surgery is an insured option for them.
Even though she says it can be a medical necessity. But according to a lawsuit, for years, Blue Cross Blue Shield of Louisiana was authorizing reconstructive surgery for out-of-network patients and only paying a very small amount of what was owed.
Blue Cross either slow paid, low paid, or no paid all of those bills over the last 8 years. They wanted to pressure the doctors in the hospital to come into their network.
Earlier this year, a jury ruled in favor of St. Charles Surgical Hospital and the Center for Restorative Breast Surgery and ordered the insurance company to pay them around $421 million. Blue Cross Blue Shield of Louisiana asked for a new trial. Recently, the judge denied it. In a statement to WWL Louisiana, the surgical hospital said, quote, "We are committed to seeing this through and continuing to serve our patients from around the world. But it's likely not over yet." In a statement to us, Blue Cross Blue Shield said the insurer, quote, "continues to disagree with the jury's verdict and the judge's decision. We will continue to appeal and expect to be successful." But for Sport, who's also a breast cancer survivor herself, all patients and survivors should have access to the important care.
If it's a medical necessity, then I would hope that all men and women who are breast cancer patients will have access to the absolute best reconstructive surgery that science and medicine can provide.
Because during a time that patients are fighting for their life, she says they shouldn't have to fight with insurance. Alyssa Curtis, WWL Louisiana.
According to our partners at the Times-Picayune, Blue Cross Blue Shield of Louisiana plans to appeal to the Fourth Circuit.